Hello, I'm Sherry. I'm your nurse today. I'm here to perform your comprehensive physical assessment. It's being documented by your grandson, Lyndon. So, before I came in, I washed my hands, and now as I came into the patient's room, I am using hand gel to make sure I am aseptic for this procedure. So now, Mr. Barber, please tell me your first and last name.
Neil Barber.
Tell me your date of birth.
4/17/50.
Can you please tell me where you are right now?
I'm in Santa Ana, California.
Yes, and can you tell me who's the current President of the United States?
Donald Trump.
Okay, you win. I'm also going to close the door so you have privacy.
Okay, thank you.
Okay, so we're going to do this because we have a bit of a time frame. I noticed looking overall, I take it all into account as I'm looking at you. I noticed you've got a little bit of color to your skin. Were you outside at all today?
Yes, I was. I was gardening.
Well, good. Gives you some vitamin D. I'm going to assess your skin too to look for anything unusual or abnormal. Is there anything that you're concerned about as I look?
No, I don't think so.
Nothing new growing, nothing new, no dark spots that you've noticed?
I got a little spot on my forehead.
A little bruise there, a little spot on your forehead. I'll take a look at that. Nothing new on your skin. Okay, look on the back side here of your neck, all the spots that get sun. And look in your scalp in here because that often gets ignored and neglected. You haven't noticed anything?
No.
Okay. Show me your spot that you noticed on your forehead. A little spot on your forehead. Atypical, a little rough.
Yeah.
Okay, we'll document it and let the doctor know about that. Okay, I'm also going to check for your temperature. And nothing hot or unusual. Check your hands, arms. You're doing okay. I'm going to check your skin turgor. This is something that would be a sign of being dehydrated. It would tint if you were dehydrated or if you had some rapid weight loss. And you've got good skin turgor. Okay.
Good.
Inspected your scalp and head. I'm going to assess your shoulder and your cranial nerves, everything that's coming out of your head. I want you to shrug your shoulders as high as you can. Now I'm going to put my hands on your shoulders and I want you to shrug your shoulders against some pressure. You did it. Now I want you to be able to try to touch your ear to your shoulder without moving your shoulder. Just bending your neck. Okay, and the other side. So the nerves work, but the muscles are a little tight. You notice that? Is that normal for you?
3 car accidents we were in.
Okay.
So, arthritis.
It's normal. Okay, now I want you to be able to turn your head from one side, and then back to the center, and then to the other side. Okay, that's doing well. I'm going to, let's look in your inner ears, your outer ears. And you have no drainage. Everything looks good. You have a little darkened skin spot in there. We'll document and let the doctor know about that.
Okay.
Okay. I'm going to assess your pupils. Okay. Normal would be that they're equal and round and reactive to light. Okay. And we use the light for this. So look straight at me. And look straight at me. And they are. They're reacting to light. That means they get tighter when I look in there. Okay.
Okay.
Now the other thing I want to do is I'm going to use my fingers and I'm going to pull down the lower lid of your eye, okay? And I'm looking for the conjunctiva that's underneath there. And it should just be moist and clear and a nice pink color, no redness, no drainage. And they look just like that, just as they should be. And I'm going to look at the whites of your eyes. I'm going to use both fingers, open your eyes, and they should be just as they are. The whites of your eyes are white. Now I'm going to look for you to track movement, okay? I want you to look at me and you're going to be following this. So look straight at me, get a vision on that. We're going to go off to the side and then up and then down. Okay, then we're going to do it again. Look at me, look at that. The side, up and down. You okay?
Yep.
Okay, good job. Okay, now the next thing we're going to be doing is looking into your mouth, okay? I want you to open your mouth wide, stick your tongue out, and say ah. Okay, now sort of through the throat, your uvula looks good. I want you to stick your tongue all the way out and go to the side and to the side. Notice that you have all your teeth and braces on them.
Yep.
So you regularly see your dentist and your orthodontist.
Yes.
Okay, no difficulty with your teeth?
No.
Okay, swallowing. Do you have any trouble swallowing food?
No.
Any trouble swallowing fluids?
No.
Can you show me how you'd swallow your own saliva right now? Everything. You did it. Good job. Okay, next thing we're going to be noticing is tongue blade, movement of tongue, assess rate. Okay. And I'm just going to be visiting with you a little bit. I was assessing your respiration rate. Normal is between 12 and 20 respirations a minute. I counted for 30 seconds and doubled it. And you're at 12, so you're right there, doing fine, but and your rhythm is normal. It's nice and regular, but you have very shallow breaths, you don't take deep breaths. You're going to want to find a way to increase your expansion of your lungs and increase pulmonary health, we call it.
Okay.
So what happens is, in regular exercise will strengthen the musculoskeletal system. You need more exercise. So it will also contribute to respiratory health. Okay, let's see, respiratory effort, put no effort. I'm going to listen to your lungs. I know you tend to get a little winded, so we're going to start in the backside.
Okay.
Okay, and we'll start at the lower lungs first, okay? Because that's where I want to hear that the lower part of the lungs, the farthest away from where you take your breath, that those are filling up nice and, okay?
Okay.
Okay, we'll go ahead and take a deep breath in your nose and out your mouth. Actually, I want you to go in your mouth, out your mouth. Take another one. Okay, deep breath. And another one. Take a deep breath. And another one. Go a little bit higher in your lungs now. Deep breath. And another one. Get a little winded. Take a deep breath. Deep breath. Okay. Okay, take a deep breath. Okay, I'll get this done for you. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay, also what I was looking as I was assessing you is your anterior to posterior ratio, and the average adult would be 1 to 2. It's a little bit less as we get older, but your ratio is about 1 to 2. You have a nice symmetry to your anterior and posterior chest size. So I'm now going to be listening to your heart rate and rhythm, okay? And I'm going to listen to your different valves, and based on where I place this, I'll hear the different valves. Okay, so on the right side, second intercostal space, I should be hearing the aortic valve. There it is right there. Okay, this is S2 is louder than S1, and then if I go to the right, to the left side, second intercostal space, the S2 is louder than the S1. Then if I go down to the fourth intercostal space, left side, this is your tricuspid valve. And then if I go down to the fifth intercostal space, this is S1 is louder than S2, and this is your mitral valve. And then your PMI, or your point of maximum intensity, is this is where you can also, a lot of people say that they can palpate or feel their heartbeat. And this is in the same space, left mid-clavicular line, fifth intercostal space. Okay, so your rhythm's just, I mean, I can't detect your rhythm, but you're just normal. You're just, everything sounds real even. It doesn't sound like you have any murmurs. Okay, I'm going to assess your carotid arteries. So I'm assessing for bruits. And a bruit is abnormal. We don't want to hear a bruit. If we hear a bruit, it's a swishing sound. There might be a stricture or some stenosis. So I just listen. No bruit. It's always a good thing to hear that everything's within normal. No bruit there either. Now I'm going to assess your pulses. Okay, your radial pulses, because we know they went through your radial artery of your right arm to put in your last stent. And what we want it to do is be back to what it normally is, and that they're both strong and equal. Good job. And then I'm going to check your dorsalis pedis pulses. These are in the front. And of course, because they went in through your femoral arteries, we want to make sure everything stays the same and everything stays open. And those are not weak, but they're moderate, but they're equal. And then I'm going to go to the posterior tib ones. Those are on the inside or the medial side and right behind your ankle. And for you, they're both equal and strong. Good job. Now I'm going to check your cap refill, and that's where I just depress your toenails a little bit, and then it should blanch a little bit, get a little white, and then the minute I let up, it should just turn right back to pink. And those are good, and I don't notice any edema at all in your legs or arms. Can I check your cap refill on your fingers, please? And those are good too. Okay, I'm going to have you lay down, and I'm going to assess your stomach and your abdomen. Okay, I'm going to look for symmetry from this side, and here nothing's abnormal or irregular. I'm going to look at it from this side, and I notice that slightly rounded would just mean that maybe perhaps a little intra-abdominal fat and maybe a lack of muscle tone, or a decrease, I should say. Don't give me that look. And I'm going to listen to bowel sounds. I'm going to listen to all 4 quadrants. Now, normal would be like an irregular, high-pitched gurgling sound, which that's normal. And normal is about 5 sounds, 5 to 30 within a minute. So I'll check all 4 quadrants. I hear some gurgling. Lots of gurgling up there. Lots of gurgling there. And lots of gurgling. Everything sounds good. I'll slightly palpate. Tell me or let me know if you have any pain or
It's
tender. Okay. We'll let the doctor know about that.
Yep.
Okay. What else do I want to do? Tell me about your normal bowel functions.
They're normal, I think.
How often do you go to the bathroom?
Once to twice a day.
Bowel movements.
Yes.
And that's your normal pattern? Do you have any difficulty or trouble having a bowel movement?
No, I've taken some stool softeners and stuff.
Okay, last time you were here, we talked about opioid-induced constipation.
Yeah,
so we recommended some Colace and increasing water, and you notice that's helped.
Yes.
While you're laying down and getting very comfortable, I want you to push against my hands, and then push your feet up toward you. That's normal. I want you to also squeeze my hands as hard as you can. There you go. That's equal to. I want you to sit up now. Tell me about your bladder function. Actually, I want you to push against my hands. And then leaving your fountain, I want you to pull up. Okay? You can tell me about your bladder function. Do you have any difficulty initiating a stream of urine?
Nope.
Any difficulty do you feel like you get a complete void every time?
Yeah.
Do you feel like you can you stop your stream if
Yes.
needed? Do you get up at night to go to the bathroom
Yeah.
a couple times?
1 to 3.
So that would be normal as we age. With men, we want to also be aware and kind of monitor that. So if you ever have difficulty or can't void completely or feel like you're not voiding completely, let us know. It could be a sign of a prostate problem. Okay, I'm going to have you stand up and show me how you walk.
Okay.
Start over here. I want you to turn around and walk straight all the way there and back, please. And come back here. Okay, now turn around again, please. And then I want you to walk. We're going to assess for balance. I want you to stick your right heel up against your left toe and look straight ahead. Do not look down as you walk. Okay, and turn around, please. Do it again. Okay, you look like you're getting a little tired. You're tired. Okay, go ahead and sit down. Okay, Mr. Barber, that completes our assessment. Do you have any questions?
No, thank you very much.
Okay, thank you.